Hi, everybody. It's Sharon Spurlock from the St. Louis Arc, and I'm here with our weekly Q&A session. Today, we have a returning guest, the wonderful Julia Schaffner, who works in our Capable Kids and Families program, but she's going to be here to talk about something different today. So, can you believe it? It is September already, which means that it's International Fetal Alcohol Spectrum Disorder Month, and the day is September 9th. So mark your calendars. And Julia is here to talk to us about fetal alcohol spectrum disorder and prevention. So Julia, welcome. I'm so glad you're here.
Thanks for having me back, Sharon. I appreciate it.
It's always good to have you here. You have such an illustrious history with the ARC. I'm not going to take up our time today by making you talk about all the jobs that you've had at the ARC, but maybe you could just talk to us a little bit about how you got connected to prevention.
I'm a veteran employee, been around for a while, and through the course of a variety of different positions, I landed in our prevention services, which has been just such an honor. I had the honor of being mentored by Melinda Ola-Miller at the time, and I really kind of dove into what fetal alcohol spectrum disorders are and the prevention piece. We had a grant to be able to invest a full-time person into that project, and it was something that interested me because there was not much known at the time, or we still don't know as much as we should, but also because of the effects that prenatal alcohol exposure can have. It really became a passion, and even though I have broadened a little bit and doing some other things at the ARC as well, I continue to have a toe in our prevention services. We have a long history at the ARC of being involved with prevention services, prevention and intervention. And the reason for that is alcohol use during pregnancy is actually one of the leading preventable causes of intellectual and other developmental disabilities. So we really have a vested interest in making sure that people understand the harmful effects of prenatal alcohol exposure. And then also, we just owe it to people who are affected by prenatal alcohol exposure to raise awareness and to help spread a little bit of understanding of what life is like and some of those challenges. As you mentioned, September, 9th month of the year, International Fetal Alcohol Spectrum Disorder Month. It is September 9th, has long been recognized as fetal alcohol. It started as Fetal Alcohol Syndrome Awareness Day. And over time, that has become Fetal Alcohol Spectrum Disorder Awareness Month. And so we have a month-long activities planned at the ARC, trying to make sure all of our staff are well aware, and then also getting some information out to the general public. So before I kind of jump into prenatal alcohol exposure, this is kind of a fun way to introduce the topic. Hi, I'm Julia Schaffner. Thank you for joining me today to learn about the St. Louis Arc Goal the Whole 9 program. I'm going to start with a little demonstration. I have an empty glass jar and an egg. This egg is not actually fertilized, but I'm going to pretend that it is and call it a chicken embryo. I'm cracking the chicken embryo into the jar and pouring about a shot of alcohol on top. You might see that the embryo is starting to change. To speed up the process, I'm going to give it a good shake and distribute the alcohol. Do you see how the small amount of alcohol completely changed the chicken embryo? We cannot do anything to reverse these effects. Alcohol caused a permanent change.
That was incredibly graphic. Can you tell us in a little bit more specifics what happens to a human when there's an interaction with alcohol during pregnancy?
Sure. So alcohol is a teratogen, which is basically a fancy word that means it's a toxic substance to developing fetal tissue. So when any teratogen, and there are many teratogens out there, when a teratogen comes in contact with a body part that is developing, it can permanently alter, change the way that body part develops. So alcohol, when it is consumed, enters our bloodstream. We talk about blood alcohol content, travels through our bloodstream, through the placenta and umbilical cord, directly into the bloodstream of the fetus. And then that toxicity is basically traveling through the fetus's body, and anything that is developing at the time could potentially be impacted. So I'm going to show a fetal development chart. So when we think about teratogens impact on different body parts, it's helpful to look at a fetal development chart. So here I have a chart with the weeks of pregnancy at the top. And I have the different body parts labeled by these purple pink bars. So as you notice, that first trimester, the first 12 weeks of pregnancy, you notice that everything is developing during that time frame. So because teratogens can change, they can harm, negatively affect any fetal tissue that's developing. If alcohol is consumed during that first trimester, almost any body part or any body part could potentially be affected. And then Sharon, what do you notice about that first bar, the brain and spinal cord?
That it's any time during pregnancy that is absolutely going to be one of the areas affected if you have a reaction.
Exactly. In addition to the brain developing through the entire pregnancy, it's the body part that starts to develop first, doesn't end development until well after that baby is born. So in addition to being sensitive to teratogens through the entire pregnancy, it also is highly reactive to alcohol. So when we see damage from prenatal alcohol exposure, it almost always includes some type of brain damage. Okay, so some part of the brain did not develop in the way that it should have because of the impact of the alcohol. Any part of the body could be affected, but the brain is the most likely to be affected. So then people often ask me, well, what about, alcohol use at the end of pregnancy? Could I just, have a few drinks when I'm miserable and in my 38th week? There are still body parts developing, including the brain. So as the fetal development chart shows us, there is no safe time during the pregnancy to use alcohol. This also poses kind of an issue because not everybody knows they're pregnant right away. Unfortunately, the fetus doesn't have the ability to prevent the alcohol from getting into its body, affecting its organ systems, just because nobody knows that the pregnancy is there. So it's really important that if people may become pregnant, that they know this information so they can make good, educated choices. And that's what this is about: raising awareness, providing education so that people make good choices going into a pregnancy.
I do think this is really confusing because I think that there's mixed messages that come from professionals. And I think the media often, I grit my teeth when I'm watching a TV show and I see a pregnant woman having a glass of champagne at a baby shower, because I think those media messages are still out there quite a bit. So let me make sure I'm understanding. What I heard you say was there's no time during pregnancy that you can drink alcohol and know for sure that your baby will be safe. No type of alcohol. And what about quantity? Can I just have that one glass of champagne?
So with quantity and with type, let's talk about the type first, because I'm going to address the wine that you brought up. So the question of, or the assumption that wine is safe to use during pregnancy is one of the most common myths. I'm going to share my screen here again. So wine, a 5-ounce serving of wine, which is like a standard serving. That's a standard pour of wine is about 5 ounces. And I know that wine glasses come in huge, huge amounts. And frequently a glass of wine is much more than 5 ounces. But a standard serving of wine is 5 ounces. So 5 ounces of wine has the same amount of alcohol as 12 ounces of beer, or like a standard bottle, standard can, or a shot of hard liquor. So basically, alcohol is alcohol. The serving sizes for different alcoholic beverages have been standardized to make their alcohol equivalencies about the same. And it doesn't matter with the shot of hard liquor if it's mixed with fruit juices or tonic water or soda. The alcohol, if that whole drink is consumed, the alcohol is still there. So wine, the use of red wine as being healthy for a baby during pregnancy, that is a myth. And I know it's a myth that has been perpetuated. And I hear repeatedly from pregnant people that they are told or have been told by medical professionals that wine is okay. But again, the fetus doesn't have the ability to distinguish between wine, beer, hard liquor, etc. And then your question about quantity. So the quantity does matter. So we know that the more alcohol that's used, the more likely there is to be damage. The higher the frequency of alcohol use as well, the more likely there is to be damage. For example, like routine binge drinking is one of the most dangerous drinking patterns during pregnancy.
Art, I'm sorry, I'm gonna throw you a curveball. We didn't talk about this, but
Yeah.
I was shocked to hear what is considered binge drinking the last time I did a presentation with Melinda. So what is binge drinking?
Yeah, binge drinking is having 3 to 4 standardized alcoholic beverages in one sitting. So 3 for most average sized females, 4 for most average sized males. Obviously, there's a little variance there. So it's yes, not as much as people think.
No, it's not. Thank you for clarifying that.
Yes, and thank you for asking that important question. So we know that the more alcohol that's used, the more likely there is to be damage. But we also know that some pregnancies are highly sensitive to the effects of alcohol, and there seems to be a variety of factors that go into play there. So the problem is that we don't know ahead of time which pregnancy is going to be sensitive and which is not. And so all major medical associations in the United States have come out with the same statement that no amount of any type of alcohol has ever been proven to be safe. Therefore, it is best to completely abstain. And what I like to point out is that the 1 or 2 drinks during a pregnancy, that's, most likely not going to cause some of the physical effects that we see, but that could be the potential of increasing the likelihood of maybe a learning disability or ADHD or something along those lines, particularly if there's a hereditary factor there. And those we know that those things do have genetic factors as well.
Okay, well, this I think can be really scary for people because sometimes you don't know when you're pregnant. And sometimes you don't know what you don't know. So I'm glad that our approach is going to be really positive with people, trying to help them learn more. And once you learn something, to make some changes in what's going on with you. So this is a spectrum disorder, which I always think of as a curve where there's different levels of involvement. Can you talk a little bit about fetal alcohol spectrum disorders?
Sure. And I do want to, I want to just expand a little bit on what you were saying. Yeah, one of the goals from our project is to destigmatize fetal alcohol spectrum disorders and to let people know that there is no judgment. And the best thing that we can do for our children is to be completely honest about what we encountered, ingested, etc. during pregnancy. So it is not, there's no criminal act with using alcohol during pregnancy. But it's definitely something that we want to raise awareness about, because again, my firm belief is that nobody enters into a pregnancy thinking, or very, very, very few people would enter into a pregnancy thinking that, gosh, I want to do this thing that could potentially have harm. It happens because people are unaware. And as you said, they may not be aware that there's a pregnancy, or they just might not know the information. And so it becomes all of our responsibility to make sure people do know, and then to wrap our arms around them and let them know it's going to be okay, and give them the information they need to be able to successfully, parent in a supportive manner.
We do have a question from the audience, and I just want to ask before you get into FASD. Is there anything, they're saying, if I didn't know and I drank, should I go and talk to my doctor? And I didn't know if there was something preventative that doctors can do. Is there some point where you should have a conversation with your obstetrician?
Yeah, so most obstetricians are going to ask that question and get a little bit of history there, just so that if there are any complications, they can know a little bit better what could be potentially going on. So it is a good idea if the obstetrician is not asking about exposures of any type. It's not just alcohol, but exposures of any type, to let the doctor know. But then also after the baby is born, letting the pediatrician know so that they have a clear history. Again, if there is any complications during the pregnancy, if there's any other exposures, lead, etc., just as much information that a pediatrician has, it is helpful. That way, if there are any signs or symptoms of anything, they may be able to address it in a more timely manner, instead of trying to spend a long time figuring out what's going on. But the best thing to do is stop. And again, we know that the less alcohol that's used, it's always better to stop, the less likely there is to be anything going on.
Okay, so let's talk about FASD.
All right. So there was a change in the recent past with our estimates of the numbers of people affected by prenatal alcohol exposure. So it is estimated now that 1 out of every 20 children have what's called a fetal alcohol spectrum disorder. And this is from the CDC. So the slide is publicly available through the CDC. So it's much more prevalent than we once believed. And for people that have worked in schools or in any kind of early childhood programming, it's fairly apparent that there is some difficulty out there. So people with FASD, so this first box, these are the physical issues that can happen. So low birth weight and growth, problems with any organ system, so heart, kidneys, etc., and then damage to parts of the brain. And I don't have a lot of time to get into it, but the most commonly affected part of the brain is the frontal lobe, the frontal cortex. And that's the part of the brain that controls our decision making, impulsivity, judgment, etc. And so the difficulties or the damage that happens in the developing brain, and these are like underdeveloped parts. So they're not parts that fully developed and then the alcohol damaged it, like in an adult brain. But it's the brain not being allowed to develop in the way that it should.
Yeah.
That is what leads to the behavioral and intellectual disabilities. So there can be learning disabilities, there can be low IQ, but I'll tell you that it's estimated that the majority of people with FASDs do not have a low IQ, a low enough IQ that qualifies them for services. So usually it's somebody who's going to be falling through those particular cracks. There might be learning disabilities that go along with it. Hyperactivity and impulsivity. I know the impulsivity is not on here, but that's a huge, huge factor. Difficulty with attention, poor ability to communicate in social situations. So communication might be pretty effective in a one-to-one situation, but in like a social scenario with people that the individual doesn't know, that might be a real challenge. And then those poor reasoning and judgment skills. These are the impacts of prenatal alcohol exposure that we really get most concerned about, because then what happens is those lead to those lifelong issues with school incidences, with legal troubles, substance use. A lot of times they're self-medicating. People are self-medicating because they might know, like, I'm impulsive, I need to slow down. I'm going to take a depressant to help me kind of slow down. You know, that could be alcohol or a different depressant. Can lead to mental health issues, so anxiety, depression, etc. So a lot of times these folks have some really high skills. They're very talented in some areas, and they're kind of uneven. And so people have these high expectations, and there may not be any physical effects from the alcohol. And so no one knows. It's like a hidden disability. So if nobody knows, and they, you know, if a provider or an educator or a parent is saying, why can't you learn from your mistakes like your sister or brother did? Why do you keep making these same bad decisions over and over and over again? That can become really hard on the individual who may be trying their hardest. So what we really try to do is help people to reframe and alter their expectations of the person, understanding that it's an organic brain disorder rather than willful in nature.
Yeah, I've heard from so many people with disabilities that have heard that from people, that they think I'm trying to get one over on them, or I won't do tasks and I just really can't process it. So the numbers you shared were pretty dramatic, and that's something really to dwell on and think about a little bit. It makes me think about diagnoses, because out of that 1 in 20, I bet very few of them formally have a diagnosis, because I know we've struggled to help families get a diagnosis to determine if fetal alcohol spectrum disorder is one of the things going on with somebody. What are your recommendations when people suspect that maybe it's FASD, but they don't have a diagnosis?
If they can get a diagnosis, that is wonderful. The other avenue to try are interventions that are not the interventions for fetal alcohol spectrum disorders. They're very supportive. So they're not punitive in any way. They're not going to harm, hurt anyone. And so maybe learning about those techniques and then putting those techniques into place and setting up safeguards for the individual. And so instead of maybe yelling at the person for engaging in, in an impulsive behavior, trying to back up and teach them, how do I set up a cue so that they don't engage in that impulsive behavior and check with me first, or whatever it might be. So trying to, again, kind of be supportive and prevent anything that's causing difficulties, and then teaching and reteaching, etc. So they're all very supportive. There is some legislation that's out there right now called the FASD Act, and I'm sorry, the FASD Respect Act, and it
Is that national?
Yes, national legislation, and that legislation would re-implement and also increase funding to provide more cohesive diagnostics, interventions, education, prevention, like basically all of it. So that funding was cut quite a few years ago, and hasn't been re-upped. So this legislation has full bipartisan support, which is amazing. So full bipartisan support, and it would go quite far in, I believe, helping people to get the best supports possible. So the ARC has a few different programs out there for staff. We're really trying to make sure that we've had so many new staff with the pandemic. Orientation or onboarding of staff has looked a little bit different. So we're trying to make sure that all of our employees know this information and have the tools that they need to be able to help other people understand it. So that rolled out just last week. And then we have some billboards going up, and then this video will be available as well. On a national level, FASD United, which is formerly NOFAST, National Organization on Fetal Alcohol, they have a clearinghouse of information and great opportunities to get involved for FASD Awareness Month. More information about the FASD Respect Act, trainings, events, etc. There's another really great clearinghouse out there called FASD Collaborative. And it also is a wonderful place to get additional training. We are available as well to provide any kind of training. We can do booths, etc. If people want to have an educational table at an event, if they want to have a live speaker come to a group, we are happy to do that. And my contact information is available there. Thank you very much for inviting me and having me here. And to everybody who's working behind the scenes, thank you so much. We are so grateful to the Department of Mental Health, the Department of Behavioral Health Services under the Department of Mental Health. They provide our grant funding for this program, and we appreciate everything that they have done and all of their support over the years, and their vested interest to make sure that residents of Missouri understand this information. To all of those that are listening today, if you can make sure that people in your circles, I always like to say, those you love and those you don't love, know this information. There is nothing more heartbreaking when I am engaging with the public to hear from someone who maybe has been struggling to figure out what's wrong with their child, and they are learning this information for the very first time and says, if I would have only known. So I just feel very strongly that we have a commitment to make sure that everyone knows. I've been pleased, you mentioned the media piece. And I have been pleased to see that that is lessening now. It used to be much more prevalent that you would see people who were pregnant. Now I see much more frequently people who are pregnant on a movie say, no, thank you, I'm expecting. And that's sending the right message. So we are here. The ARC is here. If you need any support, don't hesitate to give us a call and we can help you find the right resources.